بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. This is the 8th video in the Communication Skill course for Physician, a DVD course by Saudi Commission for Health Specialties. This is Dr. Faiza Reis with you. In the coming 20 minutes, we are going to discuss the last 8 steps of doctor-patient relationship, the partnership, how to close and maintain the relationship, and how to prepare for the next patient. Okay, the partnership. This is the steps of the partnership. We'll go one by one. Why we want to have a partnership relationship with our patient? For sure, if the patient feel that he is treated like partner, he has the equal responsibility about his health. It's not the doctor who is responsible about his health. This will improve the compliance. This will improve patient safety. He will take care of himself better. And sharing responsibility with the patient is better than shouldering the responsibility alone as a doctor. It makes the patient feel that he is in control. If the patient take his positive role in taking care of his health, he will feel he is in control. He knows all the details and he knows what to do. And it will reduce unnecessary interventions. All these things, for sure, it will result in better health and will reduce unnecessary interventions. Okay, doctor-patient relationship, partnership, why not? Some doctors, they may prefer to work in the traditional way of relationship. I am the doctor, I am responsible, you are the patient, you respond to my order. Because physician will not feel relaxed and happy when patient start to negotiate, to argue, to refuse. I don't like this, I prefer this. Some doctors, or maybe it is even majority of doctors, maybe they don't feel happy to negotiate and argue and to patient refusing their orders. But I want to remind you, this is doctor and patient interaction. It is a challenge for confident physician. If the patient starts to argue, to tell you, I don't want this, I want this, I read in the internet this is a challenge. A confident doctor consider it an opportunity to consider it a stimulation from the patient to go and to see what is there in the internet, what the public say about this, what the newspaper they saying about this. Okay? And remember, the patient, he may negotiate with you, he may argue and he may refuse. This is not because he has personal problem with you. This is out of his anxiety. He is very anxious. That's why he argue and he discuss. If we manage to see the real picture, we manage to see the invisible feeling and to hear the unspoken suffering, I think you will accept this. You will feel empathy with his argument and his negotiation and even his refusal. So try to picture patient appropriately. Patient is patient. He is weak from inside. And when he argue more and he discuss more, because he is more anxious. Okay? Some of you may ask, when we do partnership, is it all the time, sometime? In fact, a lot of this medical decision making, it's controversial. So when there is controversial management decision, it's better to work with partnership with the patient to choose what is best by negotiation with the patient. In chronic disease, patient is responsible about his illness. He needs to know how to do the follow-up for himself, how to measure his blood pressure, how to measure his blood sugar if he's diabetic, how to calculate the calories he will take. He should be working as partner to know all these details and to work on all these details. In asthma patient, for example, they know how to readjust the dosage and when to enter this medication and when to stop this medication. In dealing with uncertain diagnosis, usually when we are not certain 100% of our diagnosis, we need to share this uncertainty with the patient, so the patient will shoulder the responsibility with us. In fact, let me tell you, in every daily practice, you need patient agreement and cooperation. So, you need to adopt partnership all the time because you want the patient to cooperate with you, you want the patient to be better compliant with you. So, whatever your management, it's better to have partnership with the patient. You do it with patient agreement. It's not by ordering. Okay. If you agree that it is very important to have a partnership with the patient, let us move to how to do it. So first, define the problem which require shared decision. For example, you tell the patient, we can start plan A or plan B. We can start this medication or this medication. Or we can do this surgery or this surgery. Or surgery or medication. Whatever the options. And you tell him it is controversial. There is different schools, they recommend different recommendation. And then legitimize patient involvement and encourage his positive role. Tell him, for example, we need to find out together, me and you, we need to find together what is more suitable for you. Because plan A has this advantage and disadvantage, plan B has this advantage and disadvantage. The patient, he can decide for himself what advantage he prefers and what disadvantage he doesn't like or he cannot stand, okay? Discuss the management option, as I told you. Plan A has this advantage and plan B has this advantage, okay? And explore patient ideas and encourage questions. Tell him, what do you think? What do you prefer? After discussion of both options and the advantage and disadvantage of each, you ask the patient, what do you think, what do you prefer? And if he has any questions, it's not clear for him, clarify for him more. Okay? What do you think? It's very magical word. Number 5, negotiate mutually acceptable plan. Okay, you discuss all the options and you listen to his query and you reach to a plan. So the patient, for example, he may choose plan B. Now you tell him, okay, as you prefer, we will go with plan B. This is patient choice. You need to do this and this and expect this and this. So you tell him the detail of his choice. When you are telling the details, keep eye contact and try to watch his cues. Maybe he didn't get the idea clearly from the start, and now he starts to get anxious when you start to tell him what is the side effect or what is this medication it will cost him. So recognize his cues and respond immediately to his cues. You can ask him directly, how do you feel? Do you have any question? This is continuous. You can ask, how do you feel? What do you think? Do you have any questions? You can say it many times while you are discussing management option. Okay? So you frequently take feedback. What do you think? If the decision is a big decision, to do this surgery or to do this surgery, to take medicine or to do surgery, something big, the patient, he has the right to take his time to think of all the information he got from you and to ask others if he wants a second opinion. He has full right, if it is a big decision, to have a second opinion. So give him time, enough time to make his decision. You don't need in a big decision to make it at once. Give the patient time to think and rethink and ask second opinion and to come with the final decision. But the final decision is going to be his decision. Okay? Now let us discuss what are the myths, what are the truth about partnership. Some doctors, they may say it costs a lot of effort and a lot of time to do all this discussion for management. I am the doctor, I know what is the best for him, so I just tell him what I know the best. Do this, finish. The truth, if you discuss with the patient, if you treat him as a partner, this will improve the compliance, because when the patient feels that the decision is his decision, he make the decision shared with you, so he will be more compliant and he will be more satisfied because he make the decision. Okay? Some doctors, they may think this will reduce their prestige, reduce their rights. I am the doctor, the decision is my responsibility. It is my right to make a decision for my patient. It is a very big myth. Most of the decisions these days are controversial. Different schools, they have different opinion. So this gives the patient the right to choose. If there is a lot of controversial things and this option has advantage and disadvantage and this option has advantage and disadvantage, I am the patient, I know what suits me more. What advantage I can take and what disadvantage I cannot accept. This is all about partnership. We will move now to step 7, closing and maintaining the relationship. Okay, we finish the consultation, we do all the things, the greeting, the building rapport, we examine the patient and we make good use of physical examination and we show our patient our empathy and we treat patient as partner. Now we finished and we want to close the consultation. What do we do in consultation? We do 3 things, very important. Summarization, as we said, whenever we give a lecture, we give introduction and then we give the main lecture and then we give a summary. It is the same. We are telling the patient a lot of information, so it should be introduction, the main body of the lecture and the summary. So at the end we need to summarize what we have done during this consultation. And we need to take feedback to be sure that the patient understand and get all what we have told him. And lastly, we need to ensure patient is satisfied. In any smart relationship, in any business, nowadays they consider customer satisfaction very important, and you need to ask final questions about customer satisfaction. So how can we ask about our patient satisfaction like any other intelligent interaction? I will show you. For example, at the end of the consultation you tell the patient خلينا نلخص الموضوع، انت عندك كذا واحنا وصفنا لك العلاج كذا وانت حتستعمله كذا وموعدنا القادم ان شاء الله في التاريخ الفلاني. Okay? This is a summary. And then you ask the patient ممكن تعيد لي أهم النقاط اللي اتفقنا عليها اليوم وممكن تضيف عليها عشان أتأكد إنه أنا وصلت لك هي صح. Okay? The patient will repeat, and when he repeat, either he repeat everything correct, fair enough. If not, you correct the things which is not clear for him. And how to ensure satisfaction? You tell him at the end في أي حاجة تانية تبغاها مني? It's very magical word to ask the patient, is there anything else you want from me? He will consider you his hero. You are asking him if he wants anything else. Okay? And usually patient, when you ask this question, they will tell you, thank you very much. Everything is okay with me. Or he may tell you he needs something. Either you can do it now instead of the patient go and make doctor shopping to go to another doctor. Or you can make another appointment if the things he wants from you is big and you cannot do it now. Okay? What are the myth and what are the truth about the closing and maintaining the relationship? Some doctors, they may say, we are working with patients, not with customers. This is too much spoiling to make sure they are satisfied. They should be satisfied. I am the doctor, they should be satisfied with me. Okay, but the patient, he will tell you, I am a respected citizen. I am your customer. You should treat me with respect and you should ensure that I am happy with your service. Okay? Some doctors, they may say summarizing and feedback is exhausting repetition. Here I want to remind you that Prophet Muhammad sallallahu alaihi wasallam, in a lot of hadith sharif, they say قالها ثلاثا. He said the things 3 times. If Prophet Muhammad say things 3 times, you find these things difficult for you to say 3 times, say it 3 times, 10 times if patient needs more and more to understand. So it is not unnecessary repetition. Patient, he will tell you, I am anxious. As we said, all patients, they come anxious about their symptoms, anxious about the complications. In this situation of anxiety, do you think he can remember everything you are telling him? No. Patient tell you, I am anxious, I cannot remember everything. please repeat. Some patients, they will not volunteer this request from you, but they feel ashamed, as if they are not paying full attention, or as if they are admitting that they are they cannot remember, or they are not intelligent enough. They may not ask for repetition, but you should know that patient need repetition. So repeat the important point. And usually the important things, when we say it in the middle of the conversation, they may forget it. So the important things, we should insist on it and repeat it at the end of the consultation, because last impression, it will be remembered more. The recall will be better. So please make your closing more effective. Now we will see the role play, how we are doing this closing.
طيب هنعطيك تحويل إن شاء الله طب المناظير ونشوفك بعد أسبوعين.
طيب ما كده أسبوعين مو كثير دكتور ولا؟
أنت عارف المواعيد عندنا. طيب والسلام إن شاء الله.
طيب ما في دواء ممكن يستخدمه ولا شيء؟
الفترة الحالية ما يحتاج حاجة، حتى نشوف إن شاء الله التحليل ولا شيء نتيجة.
لأني أحس والله ما صرت يعني آكل ولا شيء. ما ممكن فاتح شهية كذا.
ما يحتاج شيء نهائي.
ما يحتاج.
السلام إن شاء الله.
الله يسلمك. شكرا دكتور.
طبعا المحلول هذا لابد انك تاخذه. التخدير حيكون عباره عن ابره مهدئه موضعيه عن طريق الوريد 10-15 دقيقه وانت رايح البيت. سلامتك. بس روح ادي اوراقك الاخوان عشان نحطك على الليسته حقتنا. ايوه اوكي. أستاذ هتان، أنا بالنسبة لي أبغى أتأكد إنه أنا ما أكون نسيت حاجة ما قلت لك عليها، فحابب إنه أنت تعيد علي الكلام اللي قلت لك إياه عشان أتأكد إنه ما نسيت شيء.
طيب دكتور، أنت أول شيء قلت لي إنه أكون صايم 8 ساعات وفي محلول أخذه عشان ننظف لي الجهاز الهضمي.
ممتاز.
بعد إن شاء الله في الصباح هنسوي المنظار يكون فيه مهدئ كده عشان يريحني.
ممتاز.
وإن شاء الله ما تأخذ وقت
بإذن الله. طيب في أي شيء ثاني تبغى مني؟
الله يديك العافية.
ألف سلامة إن شاء الله أستاذ هبتان. نصير نشوفك إن شاء الله الأسبوع الجاي عشان المنظار.
إن شاء الله. شكرا لك دكتور.
الله يديك العافية.
إن شاء الله تكون أنت اللي تسوي المنظار.
ولا يهمك، من عيوني.
الله يسلمك.
ألف سلامة أستاذ هبتان. في أمان الله. أنا برجع أعيد عليك الكلام اللي أنا قلته. عندك حموضة في المعدة، عندك التهاب في بطانة المعدة، سببه تدخين المعسل. العلاج الأساسي حقه توقف تدخين المعسل ودواء مضاد الحموضة لمدة 4 أسابيع. في حاجة حابب تضيفها تطلبها مني؟
الله يديك العافية.
الله يعافيك. طيب هذا العلاج تصرف من الصيدلية. في الاستقبال تاخذ موعد مع عيادة مكافحة التدخين.
طيب الله يديك العافية.
ألف سلامة إن شاء الله. أرجع مرة ثانية أقول لك أهنيك على قرارك في التوقف عن تدخين المعسل.
إن شاء الله. شكرا لك.
شكرا. الله يحييك. في أمان الله.
كابتن أحمد، بالنسبة لخطة العلاج الآن أنا حكتب لك ورقة تحويل لقسم الأشعة، حيسووا لك الأشعة المقطعية بإذن الله. أنت تأخذ موعد معاهم، الموعد هذا بعده بإذن الله ترجع هنا تأخذ، لما يحددوا لك الموعد ترجع تأخذ موعد بعده بأسبوع تجينا للعيادة مرة ثانية
إن شاء الله
بإذن الله. خلال الفترة هذه اللي بال ما تسوي الأشعة حديك دواء اللي هو البروفين، هذا مسكن أقوى من البنادول، وإن شاء الله تأخذه مع الأكل عشان لا يسبب لك حرارة في المعدة.
إن شاء الله بإذن الله.
اتفقنا؟ طيب بعدين انك تقدر تعيد لي خطة العلاج هذه تلخصها لي.
اتفقنا يا دكتور انه اعمل الاشعة واجيك مباشرة.
لا حاول انه يكون في فترة اسبوع كذا على بال ما يكتب التقرير ان شاء الله ويطلع لنا.
طيب واتفقنا انه ناخذ هذا العلاج المسكن واخذه مع الاكل
باذن الله. طيب كابتن احمد تحب اخدمك في اي شيء ثاني؟
الله يعطيك العافية دكتور ما قصرت.
طيب
شكرا جزيلا
وسلامتك ما تشوف شر.
الله يسلمك يا رب.
في امان الله.
الله يعطيك العافية.
اشوفك بخير ان شاء الله.
امين. مع السلامة.
حياك الله.
طيب يا هتانا عشان نلخص لك الموضوع اللي صار اليوم، انت جيتنا معك خراج، انا قمت بتنظيفه لك كويس وحطيت لك فيه غيار داخلي، فان شاء الله الخطه القادمه حتكون زي ما حقول لك الان ان شاء الله. اول شيء حتسوي غيارات بشكل يومي ان شاء الله.
ان شاء الله.
طيب اعطي لك ورقه تمشي نروح المستوصف تسوي الغيار بشكل يومي. الشيء الثاني تمشي على مضاد حيوي، طيب ولو اوجمنتين هتاخذ مرتين في اليوم مده 5 أيام.
طيب
ممتاز. الشيء الثالث النظافة الشخصية للمنطقة المحددة، ما نبغى يجيها موية أي ملوثات تنظيفها مباشرة. ممتاز. وحشوفك إن شاء الله معنا بعد أسبوع بإذن الله.
ان شاء الله.
ممكن تعيدي هالأشياء أساس تتأكد إني وصلت لك بشكل كويس.
طيب دكتور انت اول حاجه قلت لي مضاد حيوي مرتين في اليوم لمده 5 أيام.
ممتاز.
قلت لي انه في غيارات يوميا وان شاء الله الموعد بعد اسبوع.
طيب في شيء رابع كمان قلت لك ان النظافه الشخصيه للمنطقه.
طيب
لا سمح الله صار فيها ملوثات جاها مويه تغيرها مباشره
ان شاء الله.
طيب كل الاحوال لا سمح الله لو طرأ عليك اي شيء في الفتره القادمه ممكن تراجع الطوارئ. طيب واحنا موجودين ان شاء الله. اي حاجه ثانيه اقدر افيدك فيها؟
الله يديك العافيه دكتور.
اي سؤال؟
الله يديك العافيه ما قصرت.
طيب بالسلامه يا هتان ان شاء الله. نشوفك على خير باذن الله.
شكرا
حياك الله. هلا وسهلا.
Okay, we reach to the last step number 8 of doctor-patient relationship, preparation for next patient. Okay, we close the patient, finish with us now, and we ensure that he's satisfied with our service. We are now preparing ourselves for the next patient. What are the things we need to prepare? To prepare our psychological readiness for next patient. If the first patient make me feel sad or anger or helpless, I need to deal with these feelings, for example, by taking a deep breathing exercise, by stretching exercise, doing any simple things just to get rid of these negative feelings before seeing next patient. Preparing the environment, so the examination couch should be ready and clean, all the equipment should be in place and ready. Preparing and even the computer. Nowadays we used to use the computer for the filing system in the computer, so it's better to finish, or you should finish everything about the patient and you close his file before the next patient coming, in order not to mix between patients, in order not the coming patient he will see any private things in the file of the previous patient. Okay, so you make all the environment ready. Other things you need to make it ready, the patient data. For example, this patient is coming for a follow-up, and in the previous visit you ask for certain investigations, so you need to be sure that this investigation is ready in the file. If it is not in the file and the patient he's coming especially to see the result of the investigations. If it is not ready, you are wasting the patient time, you are wasting the other patient who are waiting, you are wasting their times, and you are wasting your own time. you let the patient come to the clinic, and then you start asking about this investigation. Where is it? Let us look for it. Let us call here and call there. Let us look in the computer. All this is waste of time. If the file of the patient is not ready, ask somebody to help you to make it ready, and then you call the patient. Okay, this is simple things. It looks simple, but it reflects your credibility. It reflects your professionalism. If you are not ready, don't let the patient come. But when the patient comes, you are fully ready psychologically. Your clinic and the paperwork, the file of the patient is ready. The patient will feel that he is really welcoming, that you are welcoming him, and you are respecting him, and you are professional. So take good care of this 8th step of preparation. Now we finish the 8 steps of doctor-patient relationship. Thank you. Thank you very much.